Hello, and thank you for joining us. Welcome to Inside Adherium's Commercial Momentum with Allergy Partners. We're building a connected respiratory health ecosystem that's helping millions of people live better with chronic respiratory disease. Adherium has reached an exciting milestone with the activation of our 77th now Allergy Partners clinic. This is a key inflection point in our remote patient monitoring rollout that's driving strong commercial momentum across the United States. Joining us today is Dr. Bill McCann, Chief Executive Officer of Allergy Partners, who's been an instrumental partner in driving both our commercial integration and our digital health strategy. Today's session will focus on what this milestone means, both clinically and commercially, and we'll have a Q&A session so you can hear from Dr. McCann on his perspectives around the impact for both Allergy Partners, Adherium, and the patients that we serve. We're excited to show you how Adherium has reached a true turning point, transforming clinic activations into measurable recurring revenue growth. Our model is now proven, scalable, and accelerating across some of the largest respiratory care networks in the United States. Next slide, we're going to talk about, before we begin, please note that this presentation does contain forward-looking statements and are based on current expectations and subject to risks and uncertainties. These statements should not be taken as guarantees for future results, but rather as our best view of a strong trajectory we see ahead. Next slide, please. As I mentioned earlier, I'm joined today by Dr. Bill McCann, Chief Executive Officer of Allergy Partners, the largest single specialty allergy and asthma practice in the United States. It's an honor to have you here, Dr. McCann.
Thanks so much, Dawn. I appreciate the invitation.
Absolutely. So together, we'll share how our collaboration has rapidly scaled, why clinic activations directly translate to revenue growth, and how this model positions Adherium for continued expansion. We'll begin today by framing how our collaboration is generating real traction, and then we'll have an open discussion with Dr. McCann. So the next slide, you'll see respiratory diseases like asthma and COPD, often described as smoker's cough, are leading issues in healthcare today. In the US alone, more than 40 million people live with chronic respiratory disease. That's about 1 in 8 people who live every day with some form of breathing difficulties. Adherium is positioned to drive a solution to those. Non-adherence to inhaled medications remains one of the most costly and preventable drivers of emergency visits and hospitalization, costing the healthcare systems billions each year. Respiratory medications work, but we need mechanisms that motivate people to use their medicines correctly. And this is the problem that Adherium's digital platform is solving. Recently, we shared a webinar reporting our game-changing eye care study results. The data is powerful and the results are jaw-dropping. The eye care study demonstrated patients enrolled in that study reached the critical 60% adherence threshold that has been linked to cutting both hospitalizations and costs. The study also demonstrated that nearly 1/3 of patients maintain adherence above 80% with an overall average of 67%. This clinical data is a critical piece of driving our commercial momentum, both in our current business model and in the near term, even more lucrative contracting opportunities with US payers today. Next slide. Over the past year, Adherium has transitioned from a device deployment company, selling our technology, our Hailie smart inhalers, to a platform. So our Hailie Smart Inhaler platform is now the largest global platform offering 15 FDA and TGA cleared devices, which capture continuous real-world adherence data for nearly every inhaler on the market. However, if we go to the next slide, we're transitioning that device sales perspective into new scalable per patient revenues, really driven by our fee-for-service remote patient monitoring activity. The entire ecosystem that we're building, from our devices to our platform to our respiratory care teams, and deploying that in the Allergy Partners clinics in collaboration with Dr. McCann and his additional physicians, creates an entire ecosystem that drives recurring revenue and value for both of our organizations. Every reimbursable monitored interaction today lays the foundation for tomorrow's value. Our RPM infrastructure is built on real-time adherence data, enabling both currently fee-for-service revenue and building a footprint for future outcomes-based contracts with the U.S. payers. These are called value-based payer contracts. And again, it's the next step progression in Adherium's business model. So in short, today's revenue creates scalability for tomorrow. Now, I won't steal the thunder of Allergy Partners, so let me turn it over to Dr. McCann to tell you a little bit about Allergy Partners.
Thank you, Dawn. So, yeah, as you mentioned, Allergy Partners, we are the largest single specialty allergy and asthma practice in the United States. We're headquartered here in Asheville, North Carolina, and we have offices across the country in 20 states. We have about 140 full-time allergist immunologists in the United States, as well as 50 to 60 advanced practice providers. We have 110 office locations throughout the United States. We currently, as of apparently this morning, 77 of our 110 clinics are now live with Adherium and starting to enroll patients and billing for RPM services. We have the remaining clinics are teed up for training and onboarding by the first of the year. If we look across our entire network, we have approximately 90,000 active asthma patients in our practice, of whom 40,000 have been verified through the RPM program as being potential good candidates for remote patient monitoring. And from our perspective, from a business perspective, we see that as a tremendous opportunity to grow our revenue, but also importantly to improve the care that we deliver to our asthma patients. As I tell my doctors, this is a great way to do well by doing good. We do the right thing by the patient, but it also helps improve our financial aspect, which is I like to remind my partners, without a margin, there's no mission. And this really is a good revenue driver, but it also does it by improving care. And I think to Dawn's point as well, sets us up as an organization to have those meaningful conversations with managed care around value-based care in the future as well.
Okay. That's a wonderful segue actually into how the business model works between our two organizations. So our revenue model is quite straightforward, and it's really scalable, and it's mutually beneficial to both organizations. The clinics bill for reimbursable patient monitoring services that Adherium provides. We actually provide the monitoring infrastructure, the patient onboarding, the data, and the ongoing support, earning per patient services for each enrolled patients. Allergy Partners then bills for the reimbursable amount and pays then Adherium $55 per patient, US dollars per month. Every clinic activation turns on really a new predictable revenue stream immediately. So remote patient monitoring, how the model works in practice is that when a clinic is activated and trained, and as Dr. McCann had shared, we actually verify the insurance for all the eligible patients. We then use our call center team to actually call the patients. We consent them, and then we ship them a device. They are then onboarded through our call center. As soon as they receive the device, we actually activate the device itself. Then the monitoring begins immediately with that patient activation and proceeds to generate reimbursable revenues every single month. This is all covered through the insurance verification process that we had already undertaken. And so that's a reimbursable step within the insurance organizations. Each of these steps represents really an ongoing revenue touch point, both for the clinic and for Adherium. The results really speak for themselves. We're targeting around 4,000 active patients across all of our channels by year end within the Adherium ecosystem, with the RPM channel contributing to about 2,000 patients. Looking into 2026, we've got a pipeline of over 40,000 eligible insurance verified patients, as Dr. McCann had said, ready to fuel that 2026 growth. I recognize it's from a low base, but things are moving in the right direction, and they're moving quickly, and we're pleased with this early momentum. Our total quarter-over-quarter growth has exploded, with the RPM specific revenue growing more than 280% over that period. As we had mentioned, Dr. McCann is one of two of the top 5 major asthma practices that we're working with today. But again, Allergy Partners is a very important partnership in this opportunity for scale. Looking at the specific clinic activations, you can see that again, that scale has grown exponentially even just over the past few quarters, with 770% increases in the Allergy Partner clinic activations from March to really late November. We went from 10 clinics in early March to now 77 of those clinics. And again, each one of those clinics provides patients into the RPM system that we can turn into remote patient monitoring recurring revenue for both of our organizations. That they're in told 1,100% increase in total patient activations again from March to November. So as we sit late November, we had almost 1,000 patient activations, and that number continues to increase with over 1,500 shipments of devices to date to those patients. And again, with a trajectory of about 10,000 patients by the end of the calendar year. This is real momentum, and we're living it every single day. So all in all, this momentous milestone of working collaboratively with Allergy Partners and activating the 77th clinic in their ecosystem, again, with a plan to get to their entire 110 clinics across their board by early January 2026, is really fueling Adherium's revenue expansion with our RPM model. Every single activation is meaningful, and it gears us towards activating patients within those ecosystems. We're working together. We've got a strong rollout. It's increasing the pipeline for 2026. And as Dr. McCann had said, we're building real-time value for these asthma patients in his practice. So that wraps the presentation side of our webinar today. So Dr. McCann, I'd like to turn this over and really open it up to just a dialogue with you and maybe ask some questions and then invite our investors to then add a few questions as well. So Dr. McCann, take us back to the start. What initially drew you to Allergy Partners? What originally drew Allergy Partners to Adherium and the Hailie Smart Inhaler technology?
Yeah, it's interesting. We had spoke to a lot of other companies that were looking to do at-home spirometry for patients with asthma, monitoring spirometry multiple times a month, et cetera. And the issue I had from a clinical perspective was that really didn't fit what these patients needed. The vast majority of asthmatics, I don't need to know what their lung function is multiple times a month, but what I really do need to know, are they taking their medicine, are they taking it correctly? I mean, it is the number one cause of bad outcomes in asthma. Patients have persistent disease who are supposed to be taking a daily controller anti-inflammatory therapy simply aren't taking it. It's just a known fact. And it's the first thing you ask when somebody comes in and not doing well, are you taking your medicine?
Mhm.
And unfortunately, patients go, well, sure I am, but they're not. I know they're
Right.
not. They know they're not. They're lying to me, but that's okay. And so I looked at when I got introduced to it here, I was like, this is the right tool. It answers the question. It solves the problem that I want to know as a clinician. Is my patient taking their medicine and are they doing it correctly?
Mhm.
So from a clinical perspective, it made all the sense in the world. And it's also the most broadly applicable to the largest population of asthmatics because any patient with asthma who has a daily controller really should be on this therapy. So
Mhm.
it really fit the niche of being the right tool for the problem. And, just to be 100% transparent, working with the Adherium team has been fantastic. We have problem solved. You saw that really slow ramp at the beginning because we were problem solving, working out the system, figuring it out, and working collaboratively with the Adherium team until we sort of landed in the solution where we are now that I think really addresses a lot of the concerns and the barriers we had to getting uptake from the clinician side, which is simply you have to make it easy. You have to make it easy for the clinician, easy for the patient. What I call it hit the easy button. And that's what the new model of this sort of comprehensive plan where as a clinician, I see a patient, I'm like, I think that this really benefit you, your child, your family to have this device to make sure you're taking your medicine, doing it correctly. Patient says 100%, let's do it. Literally in our EMR, I hit a button
Yeah.
and that referral goes to the team
Yeah.
and they
The
run the
area
benefits
team.
investigation and they reach out to the patient, they get the consent, they send the device, they enroll the patient. Everything's sort of done behind the scenes. And then as a clinician, I have access to real-time data how my patient's doing with their medication. And when
Mhm.
they come in for a visit, I can see, did they take their medicine? Did they take it correctly? And then when I notice that they aren't taking it, I have a really good, meaningful conversation of what's the barrier?
Mhm.
What's the problem with the evening dose? Maybe we should go to a once a day dosing. And it really gets to the heart of the matter and makes a huge difference for those patients.
Mhm. Well, we're really happy to be part of that easy button in this relationship because, again, I think we've had a lot of learnings, and again, just working with you and your team has been so foundational. And now, with the infrastructure that we've been setting up with our call center and our respiratory therapist team to be able to collaborate with you, but then be able to provide the remote patient monitoring that's billable and that we both can reap the rewards of from a revenue standpoint, really makes a lot of sense. And now that you've reached that 77 activated clinics, how are you seeing those activations translate into clinical adoption and that recurring revenue for both Allergy Partners and, of course, then for Adherium?
Yeah, I think, like any new technology, I think you're doing, there's always for that growing pains and getting those adopters. You get the early adopters. And now we've sort of gotten beyond that. People are seeing the real value because they talk to their colleagues, they're
Mhm.
seeing the results with their patients. And once you get those first couple of patients in, it really starts to snowball. We had a meeting of all of our doctors 2 weeks ago in Phoenix, and the Adherium team was there, presented. And a lot of the physicians, or not a lot, but some of the physicians who were sort of holding back, they weren't sure, is this right for me? Once they looked at it, saw the process, saw the device, et cetera, those barriers came down very quickly. So I expect that we'll see continued rapid growth. And then from a financial perspective, you saw the hockey stick of the activations. We're seeing the same thing in terms of the revenue coming into the company as well. So again, I think it's a great way for us to, again, do well financially by doing good and doing the right thing by our patients.
Right, for the patients. And look, it's great to have partners like you that have the same mantra that we do. So switching gears just a little bit, we just shared and even a few weeks ago shared the eye care data results, the 67% adherence in COPD and the 64% adherence in asthma. How does that align with what your team is seeing in the real world use across your Allergy Partners
Mhm.
colleagues? And what feedback are you hearing from the clinicians and the patients on how the technology is actually impacting their engagement, their adherence, and even their outcomes?
Yeah, I draw from my own experience because I have about 45 or so patients who are currently enrolled. And, I had one patient, elderly lady, who was really struggling with her asthma and was changing inhalers and was very frustrated. And she was very concerned that the next step was a biologic. And that
Mhm.
for her was, she wasn't ready for that. And so we put her on the device, and very quickly it was apparent she was taking her medicine, but she wasn't doing
Mhm.
it correctly. And so she worked with a
Mhm.
respiratory therapist, got her technique under control. I saw her back 6 weeks later, and she's like, Dr. McCann, I never have to use my rescue inhaler anymore.
That's great.
Her breathing through. And so that's a lady for whom, she was doing everything she thought she should, but she just couldn't get the technique down. Similar story with a young man of mine who's a patient who has muscular dystrophy.
Mhm.
And he's always had very poor lung function. And in that instance, we were able to look at the data and realize that his disease, his muscular dystrophy, had progressed to the point where he really wasn't going to be physically able to use an inhaler anymore. It just was not going to work for him anymore. So actually, in that case, we actually took him off the program, but we put him on nebulized medications. But without that insight from the Adherium device, I wouldn't have made that decision as quickly as I did. And I think in the long run, that have a significant impact on him as we come into respiratory season. So you really get a lot of really great data that can make a huge difference in the lives of our patients.
Right. It's again, you just continue to hit it on the head that look, when there's an impact to the patients, then the financial opportunity often comes for our organizations. So it's great to hear about that. As we're looking at that RPM platform and how it's generating the data across the organizations that you serve, that are within your network and your colleagues, how are your clinicians using that data to manage their patients? I know you just gave a couple of examples that you had personally, but I'm sure you're hearing stories from your colleagues as well. How is that data really strengthening the overall value proposition for them, the healthcare system, and really the payers that support that healthcare system? So what are you hearing from your peers?
Yeah, again, I think there's just a tremendous amount of real world insights you get from your patients by having this data. And a lot of it is sometimes patients don't, their recall of what they're doing, how they're doing isn't great. And so
Mhm.
having that data is tremendously helpful. I think from a larger perspective, I think that there is going to be so much incredible actionable data we're going to get out of this, and that will lend itself to some unique research we can do in collaboration with Adherium. I think it would also allow us to strengthen our position as we're negotiating with managed care companies. One of the things that I very much am looking to do in 2026 is really going from a marketing perspective as Allergy Partners to our communities, referring doctors, et cetera, to say, Allergy Partners are the asthma doctors in your community. And part of that is because we offer all the tools, the right medication, but the monitoring, the adherence, the coaching, access to the medications, and really incorporating that into our value proposition to the communities that we serve, but also payers. And then down the line, I think as we get more and more data, looking at that value-based care that you talked about.
Right. Yeah, it's again such a great and amazing ecosystem that's being built, and again benefiting the patients, benefiting the companies. So, you talked about the Adherium, the easy button that Adherium's team has been able to really provide in this RPM model. The care team, the onboarding team, the support, they see that really has seemed to accelerate the activations
Mhm.
as we've seen in our data, as you've mentioned in your data. What's been really the most effective thing in driving that adoption for your clinics, and how do you see that approach really supporting further scale, both for Adherium and for Allergy Partners as it expands into those clinics, and then of course expands deeper
Yeah.
into their patient populations that they serve?
Yeah, over the last, gosh, since COVID, staffing has been the biggest issue in all of our clinics. We simply have been unable to fully staff our clinics. And so to add something else is just, for a lot of our practices, just hasn't been possible. And so by partnering with Adherium and having those resources provided, it allows our clinics very easily to say, okay, this is something that I can add tomorrow. I can bring the service to my patients tomorrow. I don't have to staff it internally, et cetera. So and I think too, that's one of the things that as Allergy Partners, we're always looking to how do we leverage our scale and our size to make it easier for our local clinics. I think the other thing that's really important, and as we were at our meeting in Phoenix, really started really resonating with the doctors, was they now have, every one of our clinics now has a respiratory therapist as part of their care team.
Mhm.
And the patients who enroll us have a respiratory therapist who they can reach out to, answer questions, help problem solve, help those patients do better. And so as the doctors are hearing that, like, wow, yeah,
Yeah.
I always thought it'd be great to have a respiratory therapist as part of my care team. Now they have one. And
Yeah.
so it really is an enormous value add for the clinics. And again, I think in local markets, it's going to help them distinguish themselves from other practitioners, competition, et cetera, in those markets. So it really has been a great partnership.
Yeah, it's exciting that to hear you say that, because again, it's something that we've also been talking about internally at Adherium, and the care team that we've,
Mhm.
set up, and the respiratory therapist. It's really almost in so many ways, the patient's respiratory coach that's there, that's
Mhm.
championing for them and is looking at the data, working with you guys, and again, being able to bill for that from a business model standpoint on a month over month, to create recurring revenues for both organizations. But the fact that again, nobody else has that level of support of the patients, and there's such a value to that. I would suspect with your clinics. I know our respiratory therapy team is very excited about their interactions with your patients every single day, and the rewarding interactions that results, and the fact that we get to again create a very important business model for both our companies.
And I will tell you that patients like it too. I've had a couple of patients. Maurice is our local respiratory therapist, and I've had patients say, "Oh, every month I talk to Maurice. He keeps me straight." So they appreciate having that access as well.
That is great. So if investors do have questions, please put them into the chat. We can put them into the dialogue, either for Dr. McCann to address or for myself to address. There is a question, it looks
Mhm.
like, from one of our investors. It looks like it's really more of an Adherium question. So Dr. McCann, I can take that.
Okay.
Just around clarification of comments on the quarter for quarter growth. We uh, we were really referring to the quarter over quarter growth in our activations, in the earlier statements. But from a revenue standpoint, we have released our report, both our 4C last quarter and then the quarter prior. So our 4C the quarter prior was $17,000 in remote patient monitoring revenue. Last quarter, we actually jumped up to $118,000. We have not released this quarter, of course, because we're right in the middle of it. But I think if you can look at the activations and the shipments that we're doing in collaboration with you guys at Allergy Partners, the revenue is continuing to grow at a very accelerated pace. So I'll be excited to share that with our investors very soon in some upcoming data sales releases that we're planning. All right. So I think kind of in closing, unless we have more questions that come in from the investors, Dr. McCann, I'd like to just open it up to you and let you share, your final closing thoughts on where you see the value, how you see this continuing to impact. And I think you saw that we're targeting 10,000 patients by the end of the year 2026. And where do you see your fit in helping us achieve that?
Um, well, maybe it's conservative. I sort of thought when we looked at the numbers earlier this year of 90,000 eligible patients, I said, if I get 5% by the end of 2026, that'd be great. It'd be 4,500 patients, which, I think would be fantastic. But hearing you guys talk, maybe that's being a little conservative. But I think that if we had, 4,500 patients on by the end of next year, I think at the end of the day, though, that this technology is the standard of care. That at some point, people are going to wake up and say, if I have patients with this chronic disease, I need to make sure they're taking their medication right. Similar to patients with CPAP, right? You have a monitoring report, they're using their CPAP. If I have somebody with diabetes, I've got a blood glucose monitor. I know what their blood sugars are. They're taking their medicine. I think that from a managed care perspective, not having patients with persistent asthma having this type of technology is foolish. And particularly those, if anybody's ever think about putting somebody on a biologic medication, making sure they're taking their inhaler and doing it correct. It's not, this isn't rocket science, but we've never had this technology before. And I think the other thing that's fantastic, it really engages the patient. And the
Mhm.
patients know. They're like, okay, I've got, it's got an alarm on it. I mean, we didn't even talk about that. Like it reminds the patient to take their medicine. It lights up, it beeps at them. Oh, I forgot to take my medicine. Let me go find my inhaler. I can't find my inhaler. Well, it's beeping at them so they can find the inhaler. It is such an incredibly, it's simple, but it's an elegant, elegant solution to a huge problem that everybody faces who has to take medication on a daily basis. So I think that we're really literally scratching the surface on this. And I think eventually it will be sort of the standard of care. I think the insurance companies will continue to embrace it. They largely do in the United States. There are some payers who have yet to embrace remote patient monitoring codes, et cetera. And I think that we will see that improve. And we certainly will be leading that charge as we're talking with managed care companies. Say, you guys got to cover this service because it is, if you're not, you're being penny wise and pound foolish because these are the patients who want an emergency room. They wind up in the hospital, and that is the largest driver of asthma costs in the United States. It's ER visits and hospitalizations. And this is a inexpensive way to ensure that you keep people out of the hospital. And more importantly, you improve their quality of life. And
Mhm.
that's the end of the day why we do this. So I cannot speak more highly of what you all have developed.
Good.
And the partnership has been fantastic in helping us operationalize this and make it easy to get it into our clinics. And I think now we're off to the races. And I'm just very excited to see where the data leads. I mean, I think, oh my gosh, there's so much we'll be able to do this data to demonstrate real world outcomes and how this technology can change lives. So I appreciate y'all inviting me to be here and happy to answer any questions.
Well, thank you for that. And yes, and
Mhm.
so we'll continue to commit to investing in data generation and data releases in order to make to get this to standard of care. You'll continue to see the eye care data results being released. We are just at the tip of that iceberg. I've said that many, many times. And for all of our investors out there, just to reinforce from a remote patient monitoring business model standpoint, every one of our patients that we collaborate on and get onto the technology in partnership with the allergy partner clinics that we have. That represents $55 per patient per month in revenue for us, or around $660 per patient per year, which is, again, a really solid business model for us that continues to grow. And I'm very excited to have a trajectory to 10,000 patients working in collaboration with you, Dr. McCann. So again, thank you very much for this conversation, and we'll
You're welcome.
conclude our investor webinar today. Again, thank you for your time. Thank you to our investors in supporting and continuing to be supportive of our company.
Thank you all.
Thank you.